Everybody, Dr. Rafich here from Vet Triage. We are going through this issue of JAVMA from May 2014. We are going to be doing pathology in practice. So this study, or this case series rather, comes out of the veterinary school in Michigan State University. This first picture is the heart. Notice that the heart is enlarged. These are puppies, juvenile mixed breed dogs, littermates that died naturally over a 3-week period, enlarged, which is called generalized cardiomegaly. And it's got myocardial pallor. So these arrows here are pointing to areas of the heart that are paler than normal. That's pallor. Diffuse pulmonary congestion. These are the lungs behind it, look very meaty. Lungs should normally be a light pink and very airy texture to it. These are congested, dark red, very thick. So that's pulmonary edema. And then in B is the heart also cut open. And you can see here ventricular distension. So this cavity here at the ventricle is very large. And there's also more areas of pallor with these arrows here. So in addition to these findings, they also found serosanguinous thoracic, pericardial, and peritoneal fluid, respectively, as well as miliary, white, tan foci, and the splenic parenchyma. Multifocal to locally extensive cardiomyocyte degeneration and necrosis found in the deceased dogs within the myocardium, which is the heart muscle. Occasional discrete homogeneous basophilic intranuclear inclusion bodies that peripheralize the chromatin were evident. So a few things in that sentence. Basophilic is a blue staining, blue color to the material that you're talking about on the histologic slides. Intranuclear inclusion bodies is a indication that within the nucleus there are proteins being produced, and that usually creates kind of like a pinkish purple sort of glassy appearance. Those arrows there are pointing to inclusion bodies in those cardiomyocytes, those cells of the heart. There was lymphoplasmacytic infiltrate throughout the myocardium along with interstitial fibrosis. Lymphoplasmacytic infiltrate means a combination of lymphocytes and plasma cells. And then interstitial fibrosis means scar tissue in the area between the cells. Pulmonary edema was found in the liver, mild periportal lymphoplasmacytic infiltrate with diffuse severe hepatic congestion and edema. So that's typically associated with right-sided heart failure. And let's see here. And then in this bottom image there, that's staining for parvovirus. So those dark reddish areas are indication of parvovirus. Immunohistochemical labeling is what it's called, and the staining is for the antigen for canine parvovirus. The antigen is located within the nuclei and occasionally in the cytoplasm of the affected cardiomyocytes. So chemical labeling for canine parvovirus antigen was found within the nuclei and cytoplasm of the heart cells. Polymerase chain reaction, or PCR, assay detected canine parvovirus. They were positive in the cardiac tissue, and the same for the small intestine. The morphologic diagnosis was mild to severe multifocal lymphoplasmacytic myocarditis with degeneration, necrosis, fibrosis, and intranuclear inclusion bodies. And then moderate diffuse pulmonary edema, passive congestion of the liver and the lungs. So the case summary was canine parvoviral myocarditis causing sudden death. Comments. Canine parvovirus is a non-enveloped, single-stranded, negative-sense DNA virus with a 25 nanometer capsid and a tropism for rapidly dividing cells. Here is a schematic of parvovirus. You can see the 25 nanometer capsid, single-strand DNA as opposed to double-strand helix. You get single-strand. Negative sense DNA means, I think, that the nucleotides are in reverse order. And then tropism for rapidly dividing cells mean it has a proclivity to cells that divide rapidly. Canine parvovirus, feline panleukopenia virus, and mink enteritis virus are related host-specific members of the parvovirus genus. Canine parvovirus is a well-known is well known as the most pathogenic viral antigen of enteritis in dogs. Specifically, the etiologic agent of parvoviral enteritis is canine parvovirus 2. There are 3 identified strains of canine parvovirus 2. There's 2A, 2B, and 2C. Parvovirus 2C has emerged in the past 12 years and has increased pathogenicity compared to the other 2 strains. Parvovirus is thought to have evolved from feline panleukopenia virus or a related virus in the 1970s. The genetic distinction that dictates species specificity of canine parvovirus and feline panleukopenia virus is an alteration in the code for less than 10 amino acids in the viral capsid. The clinical pathologic hallmark of parvovirus infection is low white blood cell count, known as leukopenia. Transient lymphopenia, so a low lymphocyte count, is most common because lymphoid tissues are rapidly dividing and often the first infected tissues. The resultant lymphocytolysis is most dramatic in the thymus. The thymus is an organ in the neck of dogs when they're first born. It serves as the primary source of lymphocyte production and antibody production. As dogs get older, the thymus dissolves and then eventually goes away, usually. Canine parvovirus associated enteritis is the result of viral tropism for rapidly dividing cells. The intestinal crypt epithelium is mitotically active throughout life. So later on here in this website, it shows the crypt cells here of the intestinal tract. Let's see if we can't really zoom out of it, but yeah. So anyway, so the normal crypt cells here, right there, and then the diseased crypt cell damage here. Similarly, feline panleukopenia is a result of panleukopenia virus infection, a virus that preferentially infects progenitor cells in the bone marrow. The biochemical rationale for this tropism lies in the incomplete DNA replication machinery of the members of the genus. So it probably has to do with it being single-stranded DNA and negative sense DNA. Neonatal parvoviral infection can result in severe, commonly acutely fatal parvoviral myocarditis, inflammation of the heart. Clinical signs occur from birth to 8 weeks old. The cardiac form often develops without enteric involvement, meaning without small intestinal involvement. Whether infection is from the bitch, naughty, during gestation leads to infection of the fetus is under debate. Some authors contend this type of exposure would not lead to vertical transmission, meaning mom to puppies, but rather it would confer immunity. Others contend the natural exposure of the pregnant bitch can lead to neonatal parvoviral cardiomyositis. Clinical signs of parvoviral cardiomyositis include vocalization, retching, dyspnea, sudden death. Tropism for cardiomyocytes is not surprising because these cells are mitotically active until 15 days after birth. Experimental parvoviral infection of 9 puppies followed by necropsy at 4, 8, and 16 weeks revealed cardiomyocyte degeneration and necrosis that decreased in severity with increased age. Lymphoplasmacytic infiltrate peaked at 8 weeks of age. Interstitial fibrosis increased in density and thickness, and overall expanse with increased age. Canine parvovirus travels to the heart via leukocyte trafficking or freely in blood and lymph. Major mechanism of cell death is apoptosis. In addition to apoptosis, which is programmed cell death, as opposed to necrosis, which is due to pathology from an external source. Parvovirus infection leads to cell cycle arrest as a result of DNA damage induced by the virus, and necrosis by variable mechanisms depending on host species. One study investigating the pathogenesis of parvovirus revealed increased global oxidative stress in dogs with enteritis involving parvovirus infection compared with dogs with enteritis but without parvovirus involvement. Acute myocarditis can lead to ectopic irritable foci, dysrhythmia, and sudden death. If an infected puppy survives, it's probably going to have scar tissue of the heart, which can cause future dysrhythmia or contractile dysfunction. Exposure to the virus or vaccination imparts lifelong immunity. As such, puppies represent the canine parvovirus susceptible population. marked viremia, which means viruses in the bloodstream, develops 1 to 5 days after infection. Recently, parvovirus 2B was reported as the cause of erythema multiforme in multiple puppies born to a 5-year-old English setter residing on a horse farm in Georgia. Canine parvovirus 2B infection of the skin, tongue, lymph node, intestines was confirmed on fluorescent antibody testing, on polymerase chain reaction assay, and immunohistochemical analysis, as well as transmission electron microscopy. There is another report of erythema multiforme due to 2B infection in 4 2-month-old English setters. A parvovirus has been reported to cause myocarditis in neonatal cats. In a report published in 1985, 2 13-day-old kittens were described as having degeneration, inflammation, inclusion bodies in the intestines, liver, and myocardium. These inclusion bodies consisted of parvovirus particles, although it was unclear whether this represented sequela of a feline panleukopenia virus infection or aberrant infection with canine parvovirus. Probably in 1985, I don't know if they had the technology yet for, I can't remember, so for PCR testing, immunohistochemical testing, fluorescent antibody testing, and electron microscopy. So, it's probably debatable whether or not this truly was canine parvovirus in these kittens versus actually feline panleukopenia virus. Vaccination and improved husbandry had made parvoviral cardiomyopathy an infrequent problem. There exists a dilemma as to whether it is ethical to offer puppies from an affected litter for adoption, given that they may have increased risk of sudden death in the future. So pretty gnarly. I didn't realize all that information as far as the history of parvovirus, nor that it could affect the heart. So that's a pretty crazy study. All right, thanks for supporting the channel. We'll see you again tomorrow. Bye-bye.